In this recording, we're going to discuss the adaptive immunity and focus on antibody-mediated immunity. Our B cells are responsible for our antibody-mediated immune response. And we have three different phases where they come into play. The first phase is the B cells that are being produced in the bone marrow recognize specific antigens. When that happens, it triggers certain types of B cells to change and start secreting antibodies. The second phase is antibody production and antibodies going to work. Okay, sometimes you'll hear antibodies referred to as immunoglobulins or gamma globulins. That's all the same thing, it's antibodies. And then that third phase, some of our B cells turn into memory B cells. And their job is to remember. Okay? They are supposed to remember the pathogens that we've come into contact with, and they are supposed to remember how we destroyed the pathogens the first time. And so if we encounter the same pathogen again, we can mount a quicker and stronger response the second time around. So phase one, okay? B cells process antigens and present them on class 2 MHC molecules. Okay, so here's our little B cells. Okay, and they are APCs themselves. They are antigen presenting cells themselves. And so when they come into contact with the antigen, they present it. Okay, we've got B cells that are presenting an antigen to a T cell. Okay. Once we've done that, this B cell, okay, that knows what to be on the lookout for, right? We know our antigen. This B cell will start dividing. Okay. And these B cells are turning into two different things. We've got memory B cells. Okay, we said their job was to remember. And then we have plasma cells. And notice these look a good bit different. Okay, these plasma cells are the ones that secrete antibodies. Okay, so plasma cells secrete antibodies. Memory B cells do not secrete antibodies. Their job is just to live long enough to where if we see the same antigen a second time, then we can remember how we dealt with it the first time and we can deal with it faster the second time. Now, phase two was the antibodies themselves. So those plasma cells are secreting these antibodies, and we have 5 categories of antibodies. Okay, and if you need an acronym, remember GAMED. So IgG, remember immunoglobulins, gamma globulins. IgG is your most prevalent antibody, and it's the only one that's able to cross the placenta. Okay, so we can pass this from mother to fetus. And you can see what these look like in our image to the right. You don't need to be able to visually identify one of these from the other. This is just FYI, this is what they look like. But we've also got a couple of extra functions over here just if you're curious. But IgG is the most prevalent, and it is able to cross the placenta from mother to fetus. Now IgA is found in the secretions from your body, okay, from your skin, your mucosal membranes, your exocrine glands. So you have these in quite a few body fluids, your tears, your saliva, sweat, even breast milk. Okay, so we've got another way that we can send antibodies to a newborn baby. And then IgM is usually the first antibody that is secreted by plasma cells when we come into contact with a pathogen. It is good for helping with agglutination reactions. So we've mentioned agglutination reactions when we talked about blood types, but remember anytime that antibodies come into contact with antigens, you can have that agglutination, that clumping going on. Okay. And then you have IgE, which you usually have pretty low numbers of these in your body fluids. Okay. What do these do? Well, these tend to bind to parasites, and again, we typically aren't exposed to a super high number of parasites, so we don't necessarily need a lot of IgEs, but these do also play a role in your allergens. Okay, these trigger mast cells to release their granules, which we call degranulation. So we release that histamine. And we've already talked about the histamine playing a role in your allergy symptoms, your runny nose, your watery eyes. We've even talked about some allergy medications or antihistamines. Okay, so this is one of the things that they're trying to combat. Now, IgD is our last one. This one is pretty special because of where it's found. So you don't find this one just floating around in your blood all by itself. IgD is located on the surface of a plasma membrane on B cells. So these act as antigen receptors that help activate B cells. And so the B cell makes it, and it sticks it right on its own plasma membrane and acts as a receptor for antigens to activate other cells. Okay, so IgD is kind of special. Okay, it's on the B cells themselves. Last but not least is phase 3, our immunological memory. Okay, so the first time that we are exposed to an antigen, the B cell will recognize the antigen, will make more B cells. Some of them will become plasma cells and make antibodies, but we said some of them are going to become memory B cells. Now, this is your primary immune response, right? The first time we're seeing it. We do pretty good. It's pretty effective, but it's kind of slow. It takes 45 days for all this to happen, and we call that the lag phase, and that's when you're really going to feel sick. Okay, so you might feel kind of icky for several days. Antibody levels don't peak until about day 7 through 14, and your major antibody is going to be that IgM that we just mentioned. So you could feel kind of icky for up to 2 weeks. Now, if we see that exact same antigen or that exact same pathogen a second time, those memory B cells, their job, remember, is to remember. Like, that's all we're doing, we're remembering. So the memory B cells are going to recognize, like, hey, I've seen this before. We're going to do a second immune response, which is going to last longer, and it's going to be stronger. Okay, we have a shorter lag phase. Instead of 4 to 5 days, now we're down to 1 to 3 days. Okay. Your antibody levels peak faster, so we're cranking out antibodies left and right. Now we're going to peak it somewhere between 3 to 5 days instead of 7 to 14, so that's a good bit different. And our peak is much higher, anywhere between 100 and 1,000 times higher, so we're cranking out tons of antibodies this time. Okay. And the antibody we're cranking out is also a little bit different. Now we're cranking out a bunch of IgG instead of IgM. Okay. So in our image down here, you can see we can compare how long everything takes, our peak antibody levels, what antibody is doing what, and how long this could continue. Okay, so make sure you take a look at this picture. Now, last but not least, we can compare active and passive immunities within our body. Active immunities are your cells actively responding to antigens. This could be due to an infection in your body or perhaps a vaccination that you have received. It does result in both memory cell production and antibody production. So this can be a very long-lasting immunity. Some of these memory cells can last years, maybe even your full lifetime. That is a little bit different than passive immunity. So passive immunity, you are coming into possession of preformed antibodies. So we are acquiring these either because we have crossed the placenta, okay, so remember IgG crosses the placenta, or maybe we have injected you with some antibodies, like maybe a RhoGAM shot, something like that. But because your own body did not make these, you don't have any memory cells for them, these don't last very long. So this is only going to get you about 3 months worth of immunity on average. And that concludes our discussion on immunity.